When we talk about kidney failure, which is actually a layman's word, in medical terminology, it is either called acute kidney injury or chronic kidney disease. That is a type of kidney failure which is permanent and irreversible. So it is labeled as chronic kidney disease when the functioning of kidney has deteriorated for at least 3 months. That is the duration needed to label someone as chronic kidney disease. From kidneys function going down, we mean that kidneys filtration capacity. We all know that the normal function of kidney is to excrete the toxins which are created in the body via urine. So when this capacity goes down over at least 3 month period, then we label someone as having chronic kidney disease or chronic kidney failure. Unfortunately, there are no symptoms in early stages of kidney disease, and the symptoms appear in very late stage, which usually are loss of appetite, progressive weakness, gradually evolving swelling over body parts like feet and face, loss of energy. So all these symptoms you can see are non-specific and very common in most other illnesses. So it becomes very difficult to guess whether the person is having kidney disease or some other problem. And all these symptoms appear very late by the time patient has 60-70% kidney damage. So early stages of kidney damage are not picked with the symptoms, but more through lab tests. So it is very important that we shall never rely on the symptoms. And if one is at risk, they should always get lab tests done. The most common reason is diabetes, which contributes almost 50% cases of kidney failure. Second common cause is high blood pressure or hypertensive nephropathy. Besides that, there are many other causes which contributes 10, 10, 15% cases of kidney failure, like kidney stone, excessive use of painkillers for osteoarthritis of the knee or rheumatic arthritis or any chronic pain condition. Then there is a subset called glomerulonephritis, which is infections or inflammations of the kidney, especially more prevalent in younger age group. So these 4 5 categories are the main reasons, with diabetes at the forefront, which contributes to more than half of the cases of kidney failure. To diagnose kidney failure, we need basic lab test, basic investigation, which include renal function tests, which is urea and creatinine. These tests are easily available at almost all the labs in nearby. Everyone can get these tests very easily, labeled as renal function test or urea and creatinine. So these are the earliest markers. Besides that, one can get simple urine test, which can also tell if there is something wrong with the kidneys. These are the easiest and earliest ways to diagnose kidney disease. First and foremost is dietary changes. We need to do some changes in the diet, like restricting the protein intake, curtailing the salt intake. These are the basic dietary changes, followed by strict control of sugar and blood pressure. If patient is diabetic, then we need to really focus on the sugar control because that is what is gradually damaging the kidneys. If patient is having high blood pressure, we need to keep a strict check on blood pressure and keep it under 120/80. Then there is role of some medicines which we give to kidney patients, and they help in slowing down the worsening of kidney failure. Ideally, when we speak about a chronic kidney disease arising out of diabetes and high blood pressure, it is more of a medical condition, not needing any surgical process per se. But yes, there are some cases in which the kidney failure is due to renal stones or blockage. Then that can be relieved with some sort of surgical procedure like putting a DJ stent and relieving the obstruction, or putting a urinary catheter, treatment of stone with surgeries. Another type of surgery in treatment of chronic or permanent kidney damage is kidney transplant. This is a surgery where we put a new kidney in patient's body taken from one of their family members, and that cures the patient permanently.